In therapy, we can go after labels, diagnosis, techniques, and other tools. But if we really want to understand and help the patient, we need to understand what is causing the patient problems. The patient will present us the problem in his behavior when he is talking about other people and in the latent content. As therapists, we want to learn to listen to the patient behavior and its meaning so we can start to form an idea about what is causing his problems. A patient can come into therapy and say he doesn't know what he wants help with. This lets us know this is where the patient needs help now to understand why he is in therapy. Patient: I feel I am not myself for a while now. Therapist: when did you start to notice it, patient? Ever since I came back from the war, I feel on the edge. This is an important moment. While it can be that the patient is experiencing tension since he was under a lot of tension during the war, it will be a mistake from the therapist's side to label the patient under PTSD or other labels. Instead, the therapist can ask, this feeling like you need to be ready, this tension feeling, do you know it before the war? Patient: yes, I have it since I was a little boy. This passage has a lot of information to feed back to the patient, so the patient and therapist build a working alliance that is based on what the patient needs and wants help with. Therapist: let me see if I understand what is causing your difficulties these days. You feel tense and ready to action, especially these days, like you need to be ready for something to happen. This behavior has a very good reason since you were at war, and we can get into that and what happened. This behavior is serving you since you were a kid as protection, and I am sure it has a good reason as well. This helps the patient understand that his behavior has a function in his life to protect and has a defensive function in his life today to prevent the patient from getting back to life. The patient response will let the therapist have an idea what to do next. In therapy, the therapist can offer the goal and task. Therapist: so when you have a feeling, you get tense as if you need to do something with your feelings, but then what happens? Let the patient answer. So what will be best to help you here? Feel your feelings doing nothing, or keep being on the edge. Now, both patient and therapist can start therapy on the same page, helping the patient recognize the on-the-edge behaviors that are coming up in the session and invite the feelings those behaviors cover, hence treating the cause together. Thank you for taking the time to watch, and see you in the next video helping patients treat what is really causing their difficulties so therapy can be more effective.